Growing up in the South with a house full of siblings is nothing uncommon. You may even imagine having a family of your own one day. However, have you ever wondered that this might not be possible? What if you were prescribed a drug that left you in the midst of uncertainty about your future? What would you do? How would you react? Well, let me share my story with you. A couple of years ago, I experienced a pregnancy loss at 8 weeks and was issued the drug Cytotec as a less invasive option. I was never informed of the serious side effects and ended up in the emergency room having emergency surgery as an effect of it. I incurred Ashman syndrome, which later terminated another pregnancy. Abortions, either surgical or medical, are very controversial issues that affect our community as a whole. While all women should ultimately have the choice to have one or not to have one, some options may be inevitable. So, there is a growing need to understand the full extent of Cytotec. Today, I am going to prove to you that continued use of Cytotec can be detrimental to a female's health, advocate to place a ban on this drug, and prove that placing guidelines will be beneficial to the community as a whole. First, I want to begin by acknowledging that physicians need to examine and notate side effects of Cytotec. The issuance of Cytotec for home use not only affects females but poses high risk to our community as well. Over the years, there has been increased administration of Cytotec for home use. In this, women who do not achieve complications in pregnancy are not aware that complications exist once they are administered this drug. These risks include heart attack or stroke. Also, there is prolonged hemorrhaging, which can form blood clots that can travel to the lung and heart and cause death. While physicians consider Cytotec to be highly effective and less invasive, female patients do not assert their rights to have further evaluation, which allows physicians to limit the number of hospital visits a patient has or hospitalization a patient can have, and gives the insurance company an opportunity to decrease payouts. Alan DeCharney, Nathan Lauren, T. Murphy Goodwin, 2007, Current Obstetric and Gynecology Diagnosis and Treatment, 10th edition, McGraw-Hill. Additionally, we have seen a 5% increase in blood transfusions after Cytotec has been prescribed. Surely, you can agree that our community is in need of changing how this prescription is administered. I am proposing placing strict guidelines on the administration of Cytotec. To strengthen the point, local pharmacists agree that continuous monitoring during Cytotec is needed. Implementing the ban would hold physicians liable. Fines will be placed for not following guidelines. The pharmacists can be prompted to stop local dispensing, and we will eliminate case-by-case studies to give physicians first-hand experience of side effects. In establishing these guidelines to assert hospitalization, the condition known as Ashman syndrome, which affects 1.5% of the female population, can be avoided. Because of the risks associated with Cytotec, females can benefit from guidelines being placed on this drug. Sophie Waters, 2007, The Female Reproductive System, the Rosenberg Publishing Group, Leon Smirnoff, MD, Mark Fritz, MD, 2005, Clinical Gynecological Endocrinology and Infertility, 7th edition, Lippincott, Williams, and Wilkes. I am sure that many of you can resonate with being in need of service. So let's do something about it. Ban the issuance of Cytotec unless guidelines are established that implement hospitalization. Helen Corcio, MSRN, Mimi Sicko, MSRN, 2010, Advanced Health Assessment of Women, Clinical Skills and Procedures, 2nd edition, Springer publication. In implementing these guidelines, pressure will be placed on physicians to monitor patients 48 to 72 hours. It would demonstrate that less blood transfusion will occur. In addition, females who experience trauma will receive around-the-clock care. Guidelines will enhance the physician's knowledge of the seriousness of side attack, and implementing these guidelines will reduce complications such as death, and it will eliminate the possibility of the drug being used for the wrong purposes. Physicians will have an understanding that further evaluation is needed. Now, by not evaluating patients, this will require more care, and blood will be taken from already strained local blood banks. Obtaining access to locally trained physicians is not as difficult as it used to be, so we can do something about our issues. Place strict guidelines on the issuance of side attack in accordance with FDA. John Rock, MD, Howard Jones, MD, 2008, Talendi's Operative Gynecology, 10th edition, Philadelphia, Lippincott, Williams, and Wilkes. As a result of the guidelines, physicians receive a fine for administering side attack. Females can file medical malpractice suits, and they can mandate counseling for side attack. Now, you can understand that having knowledge of the major side effects is very effective and beneficial. Addressing risk can ultimately save you a lifetime of pain and motivate your community and give you hope for the future. I have expressed to you the need to implement guidelines associated with side attack. I have also identified initiating this ban if physicians continue to prescribe the drug outside of its guidelines. What if you were the person that was issued side attack and almost lost your life as a result? Would you want others to endure the same pain? As I wrap this up, I am going to leave you with hope. Women, including myself, have been prescribed medication as a less invasive option. Never be afraid to request further evaluation. It may save your life and somebody else's.